The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease 2019 COVID-19. It caused by Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The outbreak was first identified in Wuhan, China in December 2019. The World Health Organization declared the outbreak a public health emergency of international concern on the 30th of January 2020 and a pandemic on the 11th of March. As of the 23rd of July 2020, more than millions of cases of COVID-19 have been reported in more than 188 countries and territories. Most common symptoms: fever, dry cough, tiredness. Less common symptoms: aches and pains, sore throat, conjunctivitis, headache, loss of taste or smell, a rash on skin. How to prevent COVID-19? Foods. Senna. Senna, Sana maki, is an herb that comes from several different flowering species of the cassia plants. The senna leaves, Sana maki, have been used in tea as a laxative or stimulant. Sana maki has an antibacterial element, so it boosts the immune system and helps to fight against viruses and diseases. According to popular belief, Sana maki, senna leaves, helps in preventing virus as it has elements that boost the immune system. Once your immune system is boosted, then there are fewer chances of infection, but it is not proved scientifically that it can cure viruses. Senna tea has been marketed as a constipation treatment and a detox tea. It's also often used as a weight loss aid. Senna tea can cause a number of different immediate side effects like mild abdominal cramps, nausea and severe diarrhea. Licorice root. Chewing mulethi sticks is an age-old remedy for a sore throat. Due to its expectorant and bronchodilator properties, it can cure cough, bronchitis and also reduce the effects of chronic asthma. It even loosens and thins the mucus that clogs the airways and helps facilitate its expulsion through coughing to relieve congestion. When suffering from respiratory problems, drink a few cups of licorice mulethi root tea until you get relief from the symptoms. You can also mix a 1/2 teaspoon of mulethi powder with a little honey and have it twice a day. Honey. Honey is widely used in folk medicine to treat cough, fever, and inflammation. In this study, the effect of aerosolized honey on airway tissues in a rabbit model of ovalbumin ova-induced asthma was investigated. The ability of honey to act either as a rescuing agent in alleviating asthma-related symptoms or as a preventive agent to preclude the occurrence of asthma was also assessed. Here have been several studies done by researchers around the world trying to prove the therapeutic value of honey in treating many lungs conditions. The results have been mixed. One study compared honey to dextromethorphan, the key ingredient in most cough suppressants. Honey came out on top in reducing the severity and frequency of nighttime coughs. Yogurt. Look for yogurts that have the phrase, live and active cultures, printed on the label, like Greek yogurt. These cultures may stimulate your immune system to help fight diseases. Try to get plain yogurts rather than the kind that are flavored and loaded with sugar. You can sweeten plain yogurt yourself with healthy fruits and a drizzle of honey instead. Yogurt can also be a great source of vitamin D, so try to select brands fortified with this vitamin. Vitamin D helps regulate the immune system and is thought to boost our body's natural defenses against diseases. Clinical trials are even in the works to study its possible effects on COVID-19.